Joining us now is Greg Fuller, the outgoing president of USCAP. Welcome.
Thank you. Pleasure to be here.
What kind of a year has it been for you?
It's been a very busy year. It's been a very exciting year.
What have you accomplished? What would you?
I think one of the major accomplishments, this has been a transition year for USCAP, and we are transitioning from one fabulous executive vice president, Fred Silva, to another wonderful executive vice president, Bruce Smoller. So my year has been, the major job has been to serve as the transition president to help smooth this transition in our major leadership, and I think it's gone wonderfully well, and we're very excited.
What are some of the biggest challenges in pathology today?
I think that there are multiple challenges, but the single major looming challenge is that of the pathologist's role in genomic medicine and the role that we will fill as surgical pathologists in this new era of personalized therapy, targeted treatment.
How is that different?
I think that the pathologist's role will be critical. In the past, surgical pathologists' main job is to give it a name. That's been our job. And that's a very important job because the name that we place on a disease, on a tumor, determines prognosis, it determines the treatment, and other things like eligibility for clinical trials. None of that can proceed without the diagnosis. And it's not the surgeon, it's not the internal medicine doc, it's not the radiologist who makes the definitive diagnosis, it's the pathologist. That role will remain the same, and it is, as it has always been, a critical role. But we're facing a new challenge, because in the new era of genomic personalized medicine, we are dealing with a situation in which we will have at our fingertips the entire genome data of an individual patient, of an individual patient's tumor, for example. And the question is, how do we deal with that data? And how can that data be used to help our patients? And that's the ultimate bottom line. And this is a challenge that not only faces pathologists, but also physicians as a whole will be dealing with that challenge. Now, we as pathologists are in a unique situation to be integrally involved in this new era because we are the guardians of the tissue, is the old phrase. That is, we are the ones who initially deal with a patient's tissue, with making the initial diagnoses, with performing the specialized tests that are needed, et cetera. And genomic medicine, I think, will be part of our armamentarium going forward. Now, we're not there yet. And there are many technical challenges and other challenges that we have to deal with, but that era is coming. So the question might be asked, what is USCAP's role in educating or preparing the pathologist for this era, which is coming, and increasingly over the next decade? USCAP's primary mission is education. That is what we do, and it's education for pathologists in the field, in the trenches. And we are fully prepared to step up to that challenge. And I think you see evidence of that at this meeting, which I think I'm proud to announce that this is the largest USCAP meeting that we have ever held, in the 100 and now first meeting in terms of scientific abstracts presented at the meeting, and in terms of our molecular pathology courses, which are gearing up to address this challenge.
Well, congratulations on that, having so many people here, and good luck in the future. Thank you for joining us.
Thank you. It's been my pleasure.